Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Antibiotics with the flu. Do you need them? Influenza, commonly referred to as the flu, is an illness that is caused by influenza viruses. It is highly contagious and can be passed between people via droplets when they cough, sneeze, or talk. /r/n/r/n Antibiotics are medications that are meant only to treat infections caused by bacteria. For this reason, antibiotics are not effective against viral infections like the flu or cold. /r/n/r/n Antibiotics are not effective for treating viral illnesses like the flu. Antibiotics are medications made to treat bacterial infections, including diseases such as skin or bone infections, lung infections, or blood infections. The structure of these drugs allows them to kill bacteria by various mechanisms specific to the anatomy of a bacterial cell. /r/n/r/n A common mechanism by which antibiotics work is cell wall inhibition. For example, beta-lactam antibiotics like penicillin or Keflex, cephalexin, block molecules from linking together, preventing the formation of a cell wall. This results in the cell membrane bursting. /r/n/r/n Since viruses like the ones that cause influenza and colds do not have cell walls, this type of antibiotic medication will not kill them, and the illness will persist. On top of ineffectiveness, another reason to avoid using antibiotics to treat viral illnesses is a growing problem called antibiotic resistance. /r/n/r/n Antibiotic resistance occurs when your body is exposed to antibiotics when they are not needed. The bacteria that naturally occurs in your body can learn techniques to survive even when attacked with antibiotics, which can limit the number of antibiotic medications that will be effective in treating future bacterial infections when they are really needed. /r/n/r/n Antivirals are medications made to work against viruses by stopping them from replicating. Examples of antivirals that target influenza viruses are /r/n/r/n These antivirals are recommended in the following circumstances. /r/n/r/n The viruses that cause the flu are called influenza viruses. The two most common types that cause seasonal flu illnesses in humans are influenza A and influenza B. /r/n/r/n A variety of viruses can cause other viral illnesses like the common cold, such as /r/n/r/n Taking preventive measures will be the best way for you to avoid the flu. A few measures to take that will help prevent you from contracting the illness include /r/n/r/n Infections like the flu and common cold are caused by viruses such as influenza and rhinoviruses. Therefore, they cannot be effectively treated with antibiotic medications, which are meant to treat only bacterial infections. /r/n/r/n Using antibiotics to treat viral infections is ineffective at improving or curing the illness. This overuse or misuse of antibiotics may also contribute to antibiotic resistance. In antibiotic resistance, bacteria learn to survive against the antibiotics designed to kill them, leading to decreased effectiveness of antibiotics against bacterial infections. /r/n/r/n Antivirals are medications that target influenza viruses. Examples are Tamiflu, oseltamivir, and Relenza, zanamivir. These are most effective when started as soon as possible after symptoms begin, ideally within 48 hours. The best defense against the flu is getting the annual flu vaccine, as well as staying healthy via good sleep, a nutritious diet, and staying active. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.